cutting out 60 to 70% of your stomach. First of all, any operation comes with risks. Risks, side effects of the medication, particularly the anesthesia, which is used. You can die. Like, that's a risk. That's why you sign documents. But again, whenever somebody cuts you, there's a risk of bleeding. And particularly with this operation, actually, you have to be monitored closely after the procedure, because there's a risk of you bleeding. And it can be, again, fatal. I mean, if you bleed out and the bleeding cannot be controlled, you can die. So there are those risks which come with that. But then also, when you reduce on the size of the stomach, your stomach is about here. Your stomach is around here. And then you have the food pipe, esophagus. So the stomach, then the esophagus, then your mouth. That's how your digestive canal, that's what it looks like, basic anatomy. Now, if you have a smaller stomach, it means that food can come back, reflux, you understand? So you can find yourself having burning pains in your lower throat or in your throat. You can begin noticing that food comes back to your mouth. You can get lots of bloating, discomfort in your stomach. And yeah, one, that's discomforting. But also two, remember the contents of the stomach are acidic. Your esophagus should not be as acidic as your stomach. That acid can corrode, cause inflammation in your esophagus and also in the upper part of the stomach too. That repeated irritation by the acid can cause chronic inflammation or repeated bouts of inflammation. Whenever you have inflammation happening to a certain body part frequently, you put yourself at risk of cancer of those cells later in the future. So you're at risk of throat cancers like the esophageal cancer and other cancers. That's a potential risk later on in the future, coupled with the discomfort which you already have. Then also too, if you're not eating enough, that means you're not also eating enough nutrients. There's a high chance you're not going to be getting enough nutrients, especially some of these micronutrients like the vitamins and minerals, but also general food, your carbohydrates, your protein, your healthy fat. Since you're not eating, your stomach is smaller. You're not eating enough, so you put yourself at risk of certain malnutrition-related disorders due to not getting enough nutrients. But one important nutrient which you're looking at is vitamin B12. So you have this thing, this molecule or whatever you'd call it, which is produced by a lining of your stomach. It's called intrinsic factor. Intrinsic factor helps us absorb vitamin B12. Now, if intrinsic factor is not being produced as much because you've cut away 60 to 70% of the stomach, you won't be absorbing vitamin B12 also adequately. And that can put you at risk of, you can begin getting certain symptoms which are related to B12 deficiency. You can begin getting certain nerve-related symptoms, paresthesias, tingling and feelings of numbness, burning pains. Those are signs that your nerves are being affected in some way. Yeah, and lots of other issues. Yeah, and I think that for me, the thing most about the surgery, of course, there's the gastric, you can put the band, like the balloon. That's another way, but again, it still works in the same way. It reduces on the capacity of your stomach. Therefore, you feel less hungry because you feel satisfied more often. Since you have a smaller stomach, it fills up easily, so you feel satisfied. So you don't eat as much. The whole issue for me around with the surgery is, leave the side effects aside. It's not addressing the root cause. Guys, the root cause is the wrong nutrition. And to start with, before even the wrong nutrition, it's either lack of knowledge or lack of discipline. If you don't sort those out, the problem is going to relapse. Like, it's going to relapse, even after you lose weight. I've seen people who do these procedures, and then you look at what they're eating after, and I'm like, it's only a moment before they find themselves back at being overweight or obese. The weight comes back in the period of months to years, and worse still, you normally put on more weight than you were before. So if you started this whole journey at 95 kilos, there's a high chance by the time you've had that rebound weight gain, you'll be at 100, at 105, and so on. Yeah, and also the fact that you're reducing the capacity of your stomach to take in nutrients. These people end up normally being on nutrients supplementation for like the rest of their life. So you're taking lots of pills of supplements and what to supplement those micronutrients which you're not getting. I mean, and yet you could just learn how to eat right and not have to take these pills. Like, we don't recommend any pills for our clients, no supplements. Like, I mean, there are some supplements, if someone asks, doctor, can I get maybe supplements for omega-3 or collagen? I mean, if they want, I tell them, yeah, like those ones are not harmful. Again, as long as they don't come with added junk, like some of them are coated with syrups which have high fructose and all that stuff. As long as it doesn't have lots of sugar and what, I may say, okay, fine. But I don't recommend them as the baseline for how we help people. We just get people to eat normal food. If you're eating healthy food, you actually get, I would actually urge you get basically close to 100% of any nutrients which you need, and anything which you may be missing out on, it's not a game changer. One thing I see repeatedly with people is they focus on the teeny weeny 1-2%. So they say, no. I read this research that when you use Himalayan salt, it does this. But then you look at are they doing the 98%? Sleeping well, optimizing their sleep, eating right, doing the right kind of exercise at least twice a week. They're not. But they're focusing on Himalayan salt, they're focusing on supplements, and you're not doing the 98%. This 2% is not going to do anything much for you. Yet you can do the 98% and not do this stuff, and you're perfectly fine. Yeah, so major on the major, minor on the minor. All right, let's first get into the fourth set. Well, you get a question.